y'all, it's your boy Lucci here. I use he, him pronouns, and I am the Getting to Zero and Community Engagement Coordinator here at Fenway Health.
Hi, y'all. I'm Tanika McKenzie. I use she, her pronouns, and I'm the Communication Specialist here at Fenway Health.
Okay, Communication Specialist.
I love what I do. Oh my gosh.
We're here.
I know.
Wow. Long time coming. More like 2 months, but we made it work.
Okay, well, welcome to the first episode of Pride in Our Health podcast. It's a new era with new segments, guests, some visuals, hi, hello, and a special new edition. For new listeners and viewers that don't know who or what Fenway Health is a community healthcare center that advocates for and delivers innovative, accessible healthcare, supportive services, and transformative research and education. We center LGBTQIA+ people, BIPOC individuals, and other underserved communities to enable our local, national, and global neighbors to flourish. We believe healthcare should be a right, not a privilege. That is our little slogan, but a meaningful one. Join Pride in Our Health podcast as we explore different LGBTQIA+ health topics each episode. We'll discuss the latest care options, learn about life-saving medical breakthroughs, and gather expert advice on how to be happier, healthier you. Woo. Pride in Our Health supports Fenway Health's mission to ensure that the well-being of the LGBTQIA+ community and all people in our neighborhoods and beyond have access to the highest quality of healthcare, education, research, and advocacy. So,
Perfect.
would you
That's
like?
beautiful.
Thank you. Would you like to explain the new edition of Health in Our Pride in Our Health podcast?
Absolutely. Today, we'd also like to introduce a new edition of the Pride in Our Health podcast called Let's Talk Getting to Zero. What is Getting to Zero? Getting to Zero is a worldwide movement dedicated to ending the HIV epidemic and achieving a future with zero new HIV diagnoses, zero stigma, and zero AIDS-related deaths. The Let's Talk Getting to Zero edition will serve as a platform to raise awareness on HIV and AIDS and amplify the voices of HIV and AIDS experts and activists working to end the HIV epidemic once and for all.
Woo! Shout out for the advocates.
A big time shout out. They're the ones doing the work on the ground. Shout out to advocates.
Shout out to the advocates. One of our newer segments on the podcast is Fenway 411.
411.
Woo, woo. This segment is all about updating you on what's going on in Fenway, upcoming events, or anything else that the community wants to share with everyone that is important. So, starting first off, Fenway Health has a whole bunch of support groups. This one that I'm specifically going to talk about is by Fenway Health's Aging Project. Lucy, you want to explain what the Aging Project is?
For sure. Since 2001, the LGBTQIA+ Aging Project has worked toward equity, inclusion, and community for lesbian, gay, bisexual, transgender, queer, questioning, intersex, and asexual older adults, ensuring that they can age with the dignity and respect they deserve. Some of the LGBTQIA+ Aging Project's key commitments include addressing the specific needs of LGBTQIA+ older adults for inclusive services and community, engaging in advocacy efforts to promote equity, and working towards policy and practice changes throughout the elder care network.
That is amazing and needed work.
Well.
A mouthful, for sure. Thank you for explaining their wonderful work, Lucci.
That's what I'm here for.
Do you want or need to talk about the loss of a spouse, partner, parent, sibling, other relative, chosen family, or friend? Join other lesbian, gay, bisexual, transgender, queer, questioning, intersex, and asexual adults across Massachusetts. I'm sorry, I cannot say Massachusetts.
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 I don't even know how to say it, honestly.
For a free 8-week online support group. The group is open to adults of all ages, and it will be on Tuesday evenings from 6 p.m. to 7:30 p.m. Eastern Time, running through February, all the way till April 2004. For more information on the group, or how to get information, contact information for the aging program will be available. Aside from that, we also have a couple applications open in Fenway. So aside from a few job positions that are open and you can see on our career page, if you really love us and want to work here, I love working here.
Where can you locate this career page? Fenwayhealth.org.
Ooh, thank
Careers.
you. /careers.
/careers, my bad.
First application is you have the opportunity to join our board of directors. As advocates for change, our board plays a vital role in guiding Fenway Health's mission. If you are a dedicated community leader, a resourceful connector, a barrier breaker, or a forward thinker, we want you. I'm pointing to you a lot.
We're pointing to y'all.
Nominate yourself or recommend someone who embodies the spirit of Fenway Health. We welcome diverse backgrounds and perspectives that mirror our inclusive patient population. So applications are open for the term starting July 1st, 2024. So don't miss out and apply by February 24th, this month, obviously.
2024.
Another application that's not directly by Fenway, but a wonderful community partner.
We love our community partners.
The Pride Housing Lottery is open.
Cue the music.
If you are part of the LGBTQIA+ community, and is 62 or older, you have an opportunity to apply to the Restrictive Income Housing Lottery. Applications are due February 22nd. If you have any questions, there are a few upcoming info sessions that are listed on their website. And yeah, those are the applications that are open. Now for
Observance Days / Awareness Days.
Yes, now for Observance Days / Awareness Days. Starting off with the whole month, February. This month is Black History Month. What?
Hey.
Power to the people. This year's theme for Black History Month is honoring African American artists. That includes poets, writers, visual arts, dancers, everything. Art is a powerful force for expression and healing. African American artists have long used their talents to confront social injustices and advocate for change. Their work not only sparks conversations, but also promotes mental, emotional, and physical well-being. Amazing. Follow us on social media, Fenway Health and Getting to Zero MA, as we highlight works of African American artivists throughout the month.
Hey.
And for those who don't know, artivists are
activists who use their art to create social change.
Nice.
In the most layman terms, that's what artivists are.
This month is also American Heart Month and National Children Dental Health Month. Brush your teeth and
Brush your teeth.
Brush your mouth.
Brush everything.
For specific weeks, February 1st to 7th is Patient Recognition Week. We love our patients.
We do love our patients.
February 14th to the 21st is Condom Week. Glove love.
Glove love.
Stay prepared out there. Protect yourself and others. February 26th through March 1st is Employee Appreciation Week.
I appreciate you.
I appreciate you too.
Oh.
And going on to specific days and holidays, February 4th is World Cancer Day. February 14th is Valentine's Day. February 19th is President's Day. And today, February 7th, it's is National Black HIV/AIDS Awareness Day. Lucci, do you want to talk more about that?
Absolutely. First observed in 1999, today, February 7th, is National Black HIV and AIDS Awareness Day, a day dedicated to raising awareness of the disproportionate impact of HIV on Black Americans and the importance of increasing access to HIV education, testing, treatment, and prevention services. On this day and throughout the year, it is important to acknowledge and address the social and structural determinants of health that drive the HIV-related health disparities, including racism, stigma, and mistrust experienced by Black communities.
Wow, Lucci, thank you for explaining that.
Of course. We'll be here every day, every episode.
And we have the perfect person joining us to talk more about HIV and AIDS in the Black community, and overall just the Black community in general. This will also highlight our new segment, Community Advocacy. So please introduce our community advocates.
Kelvin Powell works with the Biomedical Research team at the Fenway Institute, supporting NIH study grants and COVID-19 vaccine trials. He educates communities on research practices, particularly among people of color. Kelvin previously worked on the HPTN 061 feasibility research study and transitioned to the prevention team supervising HIV and STD clinics. Additionally, Kelvin collaborated on an NIH planning grant addressing discrimination among HIV-positive Black men. Since 2001, Kelvin has also worked as faculty and advisory board member for the National LGBTQIA+ Health Education Center at health conferences, workshops, and webinars targeting the South through relationship building and initial connections with stakeholders in locations not normally associated with interest in LGBT health.
Wow, that's amazing. Tell us more.
Kelvin is also a founding member and on the board of directors for the LGBTQ+ Elders of Color, a social group for LGBT older adults of color and friends with a mission to build community, raise awareness, and provide resources for healthcare and aging services through community events, both social and practical in nature.
Woo, welcome, Kelvin.
Welcome, Kelvin Powell, to our first episode of Pride in Our Health podcast.
Great.
We're going to start off with selecting a couple questions, icebreaker questions from this little bowl.
Okay.
And we're going to have you answer them.
Great.
Sweet. All right, so we're going to select. I'll do the first one. Tanika, if you want to do the next one.
Okay.
Just random questions here. If you could choose one song to play every time you walked into a room, what would you choose and why?
Well, I am a huge Janet Jackson fan. And Janet did this song called Better Days.
Yep.
And it really looks at, you know what, better days. You may have it rough. You may, but think better days are coming. And so, even you get up every day, I look at my Shira, which is my mom, and I'm like, the first thing I did is a picture, and I'm like, what are we going to do today, lady? And so, it may be rough right now, but better days, if you're there for the long haul, if you're there for the work, they're coming. And so just keep it positive. But better days, check it out. Janet Jackson.
Yeah, Janet Jackson, come on.
Yeah, Janet, let me tell you, that woman, because one thing I love about her albums, from start to finish, you will know what she's going through, but because she shares it in her music. And I was grateful because I actually was able to go to her last concert. And let me tell you, that's one of my, everybody loves Beyonce, but, Janet Jackson, honey, let me tell you, Demita Jo, that's my girl. And so it's so important to have somebody that's able to share their story, but also give it through music. And so I was grateful to actually, be a part of that concert. And I was like a kid in a candy store, just watching her just do her thing. And it's amazing, me being this age, but honey, it was like she was preaching to me, So when you love artists like that, but also just what she has gone through and how she shares it, I'm grateful because I felt like I could hear a song and I can remember what I was going through during that time that song came out. So it's so important to find people who are positive, but also who have a message.
Absolutely. All right, let's move on.
The next question is, who is your favorite artist? Oh. It's our theme for Black History
Well,
Month.
I will say, again, Janet, people love Michael, which I adore Michael as well, but I'm able to see Janet. Actually, I have two people. Whitney Houston is also my girl. Whitney.
Love me some Whitney.
Love me some Whitney. I saw Whitney actually at the at the Wang Center, and she was amazing. And just, yeah, that was during her, I think she had Versace dresses and stuff she was able to do during that concert. And Mama brought it. When I say brought it, she brought it. And so I just love that, someone that looks like me is up there doing the things that she's done. So I'm very grateful. But yeah.
You're speaking to my ears. Whitney's
Yeah.
my favorite artist
Whitney's,
of all time. And when most folks ask me, like, what's your favorite song, they expect, like, I want to dance with somebody.
Yeah.
Those are great songs.
Right.
But my favorite songs are, like, what's that song? Even her I Look to You, her
Yep.
last song.
Yes.
That was her speaking about her life journey.
Yeah.
You know what I mean? And even the filmography and the videography of it all. We're going off script here, but it's just I can talk about Whitney Houston all day.
Oh no, I love me some Whitney Houston. Love. Oh, and I do have another artist that I had an ex who's Italian. He I think he went. Well, he went out with me because we dated each other. But he loves Mariah Carey, and I was born the same day as Mariah Carey as well too. So, March 27th. Yeah.
That's wild.
Yeah,
That's wild. Well, when you believe Mariah Carey and Whitney Houston, if y'all want to hear.
Oh, I know. Yeah, that was gonna throw that in there too.
I did it. Sweet. Let's move on to the next question.
Great.
What is the best piece of advice you've ever received?
Well, I told you, my mom is my shero. Like, that woman told me it's okay to be gay, Kelvin. It's okay to bring your best authentic of you. And being from down south, we don't always have those people that, give you those things. In fact, some of the people that should have given you great advice, they have issues with that. You got a little sugar in your tank, you have this and this. And I'm like, she was like, Kelvin, do you, but also be as authentic as you can be. And so I took that and I was kind of carried that as my, as my sign. It's important for me, but, I can't do you, but I can do Kelvin Dwayne pretty well. So it's important to be as authentic as possible.
I love that. It's perfect.
Yeah.
It's beautiful.
Yeah.
Is my turn or your turn? I'm like, whose turn is it? I have no idea.
I keep getting like so many.
Great answers to these questions.
Oh.
By the way.
Okay. Oh, how long have you been at Fenway Health?
Fenway Health, yeah. So I did a feasibility study looking at sexual behaviors of black men who are sex men, and that was in 2008. So, and I stayed at Fenway. I finished that study, and then I worked over. There's a DPH. We have a 5-year study with DPH, which had a walk-in clinic. So we actually were at the original site of Fenway at 7 Haviland Street. Mm-hmm. And so I would have, transgenders community meetings there. We would have, and it was really great to be in that historic building because you've seen some of the first cases over there. Ken Mayer had seen some of the first cases when he was actually a resident student here at Fenway. So being there, it really gave a lot of history. So we would have walk-in clinics. So we would do tests for HIV and STDs, but then on Wednesday we would come over here and do the Wednesday walk-in clinics for DPH. And so yeah, that's pretty much.
That's wild. Yeah, a while ago.
Yeah, it's a while ago. I started there, and then I stayed up till 2015. I left for 2 years because I got a job with American Heart Association. I was director of health equities. Wow. So I was still dealing with my black and brown community, but it wasn't my LGBTQ plus community. So I really missed that community. And so I knew that I had left Fenway on pretty good terms. And so Ken Mayer, God loves that man to death, and he was able to find a position for me and create a position for me. And so I came back in 2018.
Gotcha.
So, yeah.
So you've seen Fenway Health change quite a bit.
Yeah, yes, I have. Yes, I have. It's important to, I always tell people, we are Fenway. Services change, because research, unfortunately, research, there's a time limit, and a lot of times people feel that when you're doing research, you come in, you get what you want, then you leave. And so it's important to find things that matter, but also be the face, be the voice, but also stay within the community. Find ways, back that car up and go the different way, but stay, intact with what's going on. And it's important. So that's one of the reasons that I love Fenway, because Fenway is that beacon of light. You can go to another city, but you're not going to find a place that really does the work, but also is that beacon of light for the disparities that we have to deal with day to day as people of color, but also people with the LGBTQ plus community.
I did have another question though.
Okay.
Please go ahead.
Because February is also American Heart Month.
Yep.
Did you do any work with the Black community when you were at, American?
Oh my gosh, American Heart Association. Yes, so I would go into all the communities. Remember that hands-on CPR, because they really said, okay, they wanted you to do something, not get your phones out and videotape a person, but do something but to the beat of staying alive, and make sure compression is all about the compressions, but make sure how to do it, because unfortunately it's not going to happen, in a group. It's going to happen at home with your loved ones. And so it's important for you to think about, well, if I'm in that position, what do I do? And, finding something that's easy, but also in our community, finding people that are doing the work. So I can tell you one example, talking about Heart Healthy. There's a place called the Daily Table, and the VPs from Trader Joe's went into the communities and they looked at Dorchester, for instance, and they saw that, a lot of parts of Dorchester has food desert. And so they want to figure out that, so they opened up a place right across from KFC down in Four Corners. And so instead of you going to get that meal,
Fried
they wanted to
chicken.
teach you how to be heart healthy. And so they have a nutritionist that make the food, is made on site, and they are able to keep the prices very low because of the relationships that they have with the different vendors. And so they since have made, I think 3 other places. There was one started at Four Corners, and then the second one was at Nubian Square, and I think they just recently opened one within a year or so in Central Square. But the great thing about it is made on point. And then the second phase, because I was able to work with American Heart Association, we gave them an impact grant for $25,000 because their second phase was, now we have you eating heart healthy, we're going to show you how to cook this for yourself. Because that, so instead of getting that ham hock, get that smoky turkey leg, a smoky turkey wing, you have to think, make small changes, but make sure that how to take care of the sample, because it's important for us to, we have a lot, especially in our African American culture, we pass down those recipes, and we don't have to have the bad part of the meat anymore, right? And so it's important to find small changes to make sure, but also know those numbers and what those numbers mean with, for your blood counts, understand what those mean. So, I was grateful to be able to be, a part of the voice, but it's so important to think about people that you care about. Also think about, how I can use my voice to make sure they hear. So in fact, during, I think it was 2016, I was actually able to get the Sisters of Perpetual Indulgence, and they came in, and I had all those little dummies on the ground, and I had all those sisters singing, "Staying Alive."
That's brilliant.
So it's it's a great, and that's at the end of the day, who's not going to come over and see what's going on? So once you got them in, it tells do something, but it's so important to make sure that we be the change, because unfortunately, it's going to be you. And, you're not going to have someone else, it's going to be that loved one. And we want to make sure that we're doing something and not just filming.
Yeah.
Absolutely. Are you a morning person or a night owl?
I am definitely a night owl. Yeah.
Same
here.
Yes. It's, I try to get up and that alarm just, my hand automatically hits it, and it snooze, and I'm like, okay, I don't eat breakfast this morning. I don't eat, so, and I'm always
It's cheaper that way.
trying to reclaim that time, right? And so and I can't go to bed before midnight. I've tried, and either I'm stirring or I'm watching something on Netflix, or reading an email, or finishing up that last chapter in the book, and it's just one of those things I've tried, but my body's like, nope.
Yeah.
Kelvin, you got another hour to deal with it. But if I need to get up, I can get up. But I love, me and my bed are best friends. And so, when I got opportunity to sleep in my bed, honey, it's like, okay, we're getting reconnected, and we're doing what needs to be done. So
Quality time.
Yeah, quality time matters.
I wonder where that comes from, because I also am nocturnal, and I feel like it's because, again, I was raised by my grandmother, and we used to stay up all night watching like telenovelas, soap operas.
Oh my god!
So it's like maybe it came from that, getting used to. I don't know. It's weird. It's interesting.
Yeah, it is kind of sad, because I have tried, and my work wife, who's like, you should come in at 8:30. I'm like, no, ma'am. No, ma'am. I'm just hitting alarm number 2 before that. So that's all. I'll see you at 9:30, 9:45.
That's perfect. That's amazing.
Yeah.
Oh, sweet.
Great.
Sweet. Thank you for participating.
Absolutely.
I
It was
appreciate
so
that.
fun.
Thank you. And now let's move on to the other questions.
Okay.
Could you share a little bit about your work with the Elders Group and any research that you've been working on currently?
Yeah. So, well, I had just finished a feasibility study looking at sexual behaviors of Black men who were sex men. It was called the Black Study, or Project SOS, was Project Saving Ourselves. And so it really looked at the sexual behaviors. But the great thing about it, Boston was one of 6 sites first. So Boston, LA, San Francisco, New York, Atlanta, and DC. We basically followed the guys for 2 years. We tested for HIV and STDs, but we implemented a peer health navigator because, as I stated before, we represent about 13% of the population, but unfortunately, we also represent about 56% of the new infection rates. So there was really a disconnect in our community. So we were able to, see the numbers, but the sad thing about those numbers, the second rate of folks that were getting infected were elders. And so that was because they may have, either lost a partner or they going back into the community, and they had basically lived through the pandemic, the HIV and AIDS epidemic. And so going back into communities, sometimes they don't have the tools. And so it was important for me to think about how can we be advocates, but also they didn't have a LGBT elders group. And so, when you're put in position, I got together with, at the time, Bob Lithgow. He was overseeing the aging project. And I got with him, and we got together a bunch of community leaders, and we're like, well, what can we do? And I'm like, well, and every other group had this, but I'm like, well, let's get a Black group. And so we got the community together, and so we were able to start that group. And because I was working over, I had told you I had this 5-year study, I was able to pay for the services for the meals, because it's important to have a meal a day. A meal a month to kind of get together and just talk about things. But it's so important to have just people look like you. Yeah. We also would have what we call Flashback Sundays, which more so a social thing, but it's about music. If you know anything about the Black culture, music is key, right? We love to go out. And you have Sundays was a big music day. So we would have our dance, go to tea dance or have your dance, but you would get, you have your Black folks come in, and it's just really a really great way to just see people just having fun, but entertaining and talking to people that look like them. Because unfortunately, as I said earlier, that community goes back into really not positive, environments. Yeah. Some of them have to move back into where their kids may haven't always been that, culturally competent when it comes to them dealing with their partners and stuff. They also have to move back into certain types of elder places that don't always allow them to have their partners. And so depending on where you live, when your geographical background is, it matters. Mm-hmm. And so, it's important. So I was like, listen, how can we be advocates for this? And as of that, I think we are on our 13th year of dealing with this group. So I'm grateful.
That's brilliant. Yeah. That's brilliant. How can people be a part of this group or engage
with
this group?
So again, we had talked about the Multicultural AIDS, the MAC. Yeah. And so they are housed underneath that umbrella. So get in contact with Gary Daffin from the Multicultural AIDS Coalition. And there's, I think it was a MAT.com or MAT.org website, but it's important to kind of go, because we have some amazing events. We also try to do intergenerational pieces, because I think it's important for the youth to understand that, talk to an elder, because an elder has probably been down that road that you've dealt with. And we try to have one of the intergenerational pieces, because it's important to have that youth, also the elder in the same room to have a conversation started. So whether it's an open mic night or just, watching a film and then coming back and saying, as Selma, I think Selma was our first one that we did back in 2012. So watching the film Selma and then having a safe place for these two communities to talk about it and unpack. And it was so rich, and we knew there was something that we had something there. And I'll tell you one quick thought. Our first meeting, we thought we were only going to have 20, 30 people. Ended up being like 120. Wow. Yeah. And so we were grateful, but also we knew there was a need. Right. Mm-hmm. And so once you know there's a need, you act accordingly. So we made sure that they stayed around and grants and by, whatever means necessary. But I'm grateful.
That's brilliant.
Yeah.
Oh, wow.
Yeah, that is amazing work.
Yeah, thanks.
What inspired you to pursue your current career or position?
Yeah, well, I always tell people it's important to have your toes, your feet, and every little thing. And a title's not really big for me. I mean, I've been, as I said, I was director of health equities for American Heart Association, and I was a peer navigator. I've been a community educator for the Fenway 16. And so when I found this opportunity, it was still able to work within the community as a whole, but also do research because without research, you don't have data. Without data, policy doesn't move. Right. And so it starts with research. And so I wanted to make sure that, my Black and brown knew about the things, how to protect the sample, but also, I know where a lot of those folks, hang out, they chill. So and you won't get data. You want to make sure that they know that it's important for us to be part of this data because we look a little bit different than our white and Asian counterparts. And so it's so important for us to, be that change, but also be a part of this.
Absolutely.
Yeah. Oh, that's good. I always feel kind of weird, like looking at statistics sometimes. Yeah. I'm like, what was the population behind it? Like, will it actually refer to me?
Yeah. Well, that's just it. It's like, because a lot, there's a lot of things that have been put into place since, because a lot of times in our community, we don't want to be a part of those things, but it's because of the isms that have happened back in the past, whether it's Tuskegee or whatever, so it's important that, those things did happen, but because those things happen, research has made sure that they put things in place that make sure that doesn't happen again. Mm-hmm. And so, I can't change with that, but what I can tell you is the work that we do is important, but we want you to be a part of it, and I want my Black and brown because it starts with you understanding how to protect this temple. Mm-hmm. And if you don't know how to protect this temple, then I feel that you're doing yourself, no good service. Yeah, absolutely. So,
yeah. How do you gain that trust?
Man, you know what? Being that face, going out there, because it takes a minute, but people need to see you a couple of times. They need to know that you're just not in here to get what you need to get and run. Right. Mm-hmm. And so even though I don't care whether they still think I'm testing folks I don't really care, but as long as they remember, oh, that's Kelvin, remember he did this. Mm-hmm. Or he was on one of the faces of Fenway when they first moved over at that big, gorgeous building at 1340 mm-hmm. Boylston Street. So whatever that looks like, I also used to go and test at sex parties. Yeah. And so just being there, but being in that corner, and saying, Mom gave me the gift of the gab, so we can sit there and talk about it. But they feel comfortable. They bring that barrier down because it's all about bringing the barrier down and making sure people know. Because at the end of the day, I don't care what you do, but you need to know if you have an oops, know what to do and make sure you know how to get these services. And so, how do you navigate that? How do you bring that in? And so, I want to at least have that voice or have the updated information to provide that to you.
Knowledge is power.
Knowledge is power.
Knowledge
Absolutely.
Is power. That's brilliant. Who has been the most influential person in your journey and why? And I know you've shared it a little bit.
Yeah. I mean, I have a couple people. I will definitely tell you this. My mom, first of all, Alberta Phillips, who...
say her name.
Alberta Phillips. I say it loud and proud. I adore that woman because she, at the end of the day, she was one of those people that, say, Kelvin, you got a gift. And use that gift, but be as authentic as possible. And so she allowed me to be okay for me to have that little sugar in my tank, to be a little gay. So I'm grateful. I'm grateful that I was able to not, because growing up from Mississippi, which is where I'm originally from, not everybody likes, want to hear about that, much less they want to, send you and put you in different boxes. And I'm like, hate me if I ran over your car, hate me if I, hit your dog, but don't hate me for something you're never going to see me do with my partner. And so I make sure that there's a LGBTQ plus on the back of the work that I do, because, be part of that change, because everybody got something to say, but what have you done to change those options? And so it's important for you to be the part, but also that's my first person. I will tell you one other person here, and her name is Teresita Duarte. Teresita is, she works at Fenway Health. And she is my second work wife. She is a guru when it comes to trying to find financial pieces. But I've seen her come from an environment. In fact, she'll tell you her story. And I think sharing a little bit piece of her story makes people feel comfortable. And I've seen her people just from day in and day out. I'm grateful to have a person like that I can go and chime in and say, hey, what do you think about this? Because she is also a part of the community, and I just want to make sure she gets that shout out that she deserves.
Absolutely. Yeah. Perfect place to shout them out.
Yeah, absolutely.
Appreciate that.
Okay, next question. Since it's Black History Month, are there any Black LGBTQIA plus activists that have inspired you?
Oh, absolutely. A lot of people didn't know this story, and I really didn't know it until I came to Fenway, but Bayard Rustin, who is is actually the architect that when it comes to, the March on Washington. And a lot of people, he had to take that back seat because he was a gay man, and they were like, listen, our Reverend Martin Luther King, they didn't want that to be, to be the lead. And he took that back seat, but that man, he's the reason for the season, And so I'm glad that we actually have the Bayard Rustin breakfast and how we honor him every year with that. So that's definitely someone that I really am amazed, but also really appreciate it that he is kind of giving his worth, but also he's a guy that looks like me, and he was very proud of who he was. And back in those days, a lot of folks, didn't really want to hear that. Because, he was taken away from the push, that we were trying to do in our, as civil rights push. And I think, he unfortunately wasn't as popular because of that, him gay, but he's always kept his authenticity of who he was. Yeah, he was always, and I think that was important. So seeing somebody, even back in those times, it was important. And so I honor him.
That's brilliant.
Yeah.
And
That's
if
amazing.
you want to learn more about Bayard Rustin, there's the movie Rustin on Netflix.
Oh, it's amazing.
So
yeah.
definitely check it out.
Yeah. And also we have every year, we have the Bayard Rustin breakfast, which is a great opportunity. And it's normally at the JFK Library. So it's Museum and Library, which is an amazing spot. But it's so important to honor someone that looks like us, but also has done the work.
Absolutely.
Yes.
Absolutely.
I think it's in April.
Yeah, I think it's in April.
Yeah.
I don't want to give wrong dates, but
Yeah, April.
Okay, it's in
Mid-
April.
Mid-April. I
So
think.
look out for it, guys.
Yeah. So how would you define health equity, and how does health equity play a role in your work?
Understanding the work that we do, it's important that people know, because a lot of times, especially in our community, we are the last to get that information, right? And so I want to make sure that they know. I'm gonna tell you a quick story. One of my best friends, when we found out, because actually Fenway Health was had a study that looked at PrEP and PEP, and so I went. He was living in Atlanta at the time, and unfortunately the infection rates down there were crazy. And so I went down and told him, because I wanted him to know, hey, this is this new drug that's coming out there. Not that I'm telling people you have to take it, but letting you know that is something that's on the playing field. Well, that was back in 2012. Well, back in 2019, I get a call from him, and he says, Kelvin, I'm positive. And it hurt my heart because he didn't take that advice, but he was like, I'm sorry. I'm like, well, at the end of the day, I didn't tell you. I just wanted you to know how to protect your temple. I don't want to be shaking any fingers, because life is life, and you had your reason. But we need to be that change. But also, it's important for my community to know, because we used to, back when I was at 7 Haviland Street, we used to take calls from the gay and bisexual helpline. And when people found out, you had sex yesterday, well, you have 72 hours to come in and protect this temple, from you getting the virus. That's a game changer. At the end of the day, it's your tool belt to understand how to, your sexual tool belt. So whether you do it or not, just know it's there. So when you have that oops, you have another option that you maybe didn't have.
What piece of advice would you share with folks who are starting out in the field of public health?
Be patient. It's important because a lot of times people still come to meetings and they see me. I always tell people I am the pepper in the sea of salt. And if you know that statement, you understand that a lot of times I don't see people that look like me. And in the audience or in the places, and and sometimes people get discouraged because they don't see a person that look like them. It's important for us, especially my younger generation, I'm ready to pass that torch, but also pass that baton to someone that looks like me. and to make sure that we continue to go and continue to reach those communities, because it's, I can talk with my elders, I can talk to this group, but sometimes I can't talk to the youth, I can't talk to these other environments. So it's important to have someone that looks like that non-binary person, or looks like that transgender person, but also be that person of color, because it does matter, and it does matter because it brings those barriers down, because we all have barriers. And, if you feel a little bit comfortable when you have somebody that looks like you across the table from you.
Yeah.
So I think it's important.
Is there anything else you would like to share with us about any research or anything like that?
Yeah, well, we are doing, first of all, Fenway Health does have a DPH-funded sexual health clinic, and it is so important for our community to come in. I was part of a study called Here Ready, which really looked at the youth, that age group from, I think it was 14 to 24. Unfortunately, they're about 17% less likely to get PrEP or PEP. And that first part of that phase was doing a qualitative interview to see, well, let's not us assume we know what you need, but we're going to ask you questions to let you talk about what you need and what's been your barriers, what's been those isms in your life, whatever those things. And so then once you have that data, we then wanted to make sure we had a youth advisory board to see how we can bring those, whatever those barriers are, down. Yeah. And so I think it's key, really finding the opportunity to meet those kids where they're at and then bringing those barriers down, because whether it's, your family, whether it's your religion, whatever, it's other friends, whether it's just the stigma, find out what that is. And, because it starts with you, and if you can help be that change, then do it.
Have you ran into this is off script.
No.
Have you run into some barriers that are harder to, I guess, get over than others?
Yeah, it's funny that you said. It's interesting because some of the barriers are people that just doesn't understand the work that you do. Mm-hmm. And, people come from different, ways of life, ways that they view, a person that's of color, but also a person that's gay. And so it's just, I've had people that, because, they're like, well, why do you do the work that you do? Are you getting paid money? I was like, no, I'm doing it because that's what we're supposed to do. I come from the old school. It took a village to raise this child, right? Mm-hmm. And so I remember those people that say, Kelvin, ain't nothing down there for you. And so I turned around and went back. I didn't know why they told me not to go down there, but they saw something in me a lot bigger than I saw in myself. Mm-hmm. And so it's so important to make sure that you have, those beacon of lights, those people that, those angels that we have, but also, and then listen to what they have to say and act accordingly. Because I'm grateful. I'm grateful that I did have someone that saw something that I didn't see in myself at the time.
You found your calling.
Yeah, it's, it is what it is. And it's, I get up every day and I'm like, okay, what are we doing today? Right. And then you have to come with that mindset, because a lot of people wants to see you. I mean, they'll remember that one thing. You may have done 87 things, but that one thing that you did, wrong, people will remember that. Right. And so, you know what? You're human. We make mistakes, but get up, shake it off, and keep going.
Absolutely.
Yeah.
Absolutely.
I mean, that was already an inspiring message. But
all of it has been inspiring.
Honestly. But is there a message that you'd like to leave our viewers or listeners with?
Message is that we need to, especially in the times where people are really wrestling with who they are, we really need to be as authentic as a person as we can be. I can't tell a transgender person how to walk in the streets and be who they are, but I can tell a person of color, be as authentic as you can be, because it matters, and your voice matters. But do you, boo.
That's powerful. And then to just close this off, this is a question we'll be asking all our guests. What does pride mean to you?
Pride. It's knowing that I can go to my physician, and I can tell him about my sexual history. I can tell him about, and he will give me the best up-to-date information on how to protect this temple.
Mm.
And so it's so important to know how you can be that change, but also know how to protect you. And it starts with you, because and then I can pay it forward. It's all about letting other folks, but it starts with you, because I love me. So if you don't,
As you should.
yeah, as you should, you got to love yourself, but also you got to know how to protect that temple that we have, and then once you do know it, the work starts with you.
That's brilliant. Thank you, Kelvin.
Thank you guys
thank
for
you so
being here.
much.
I do have one lasting thing. There's also
absolutely.
an elders group. It's called Pride. They're just opening up right now. They're actually doing a lottery service where there actually is a residence place in JP that is dealing with basically an elder home for LGBTQ plus community. So it's called The Pride.
Oh,
So,
wow,
of
that's
all
perfect.
things, yeah. So check it out. But they are right now. They're having a lottery too. So if you're, I think, right, 62 and up, check it out. Look at they're doing some different places around in the community, and so definitely look them out and look for them. And also, I talked about the walk-in clinic, DPH walk-in clinic. They will test you for HIV and STDs, and then they also have navigators that can help you, whether it's trying to make sure that your health care is up to date, but they find different things that are new in research, and they are culturally competent, so they do look like you, and I think they are also hiring. So if we have any people, BIPOC folks that are looking for a job, we want you to come and definitely come in, because Fenway is all inclusive. We don't care if you got a dollar or a dime, but we will help you make sure that you can protect that temple.
Amen.
Yeah.
Amen. Thank you, Kelvin.
Thank you guys for
Thank you
doing the
so
work. We
much.
appreciate
I
it.
appreciate you so much.
Something that I took from him was to just be authentically you, especially as a person of color. I feel like sometimes it's really hard to just go out there and be like, it's me. It takes me a while to like let down my barriers and feel safe. But at the end of the day, you just got to be authentic, be yourself, and live your life and not judge other people.
Yeah, that was beautifully said. I think just to echo your sentiment, I would say to protect your temple.
Oh, yeah.
I think that's something that stayed with me. You gotta protect your temple. Ain't nobody gonna protect your temple but you. So just keeping that in mind, I think something I took away from Calvin's interview.
I love it. Protect your temple.
Protect the temple, y'all.
Prep.
We should do
Condom week.
Oh my God, we should do stickers that say protect your
You
temple.
just love stickers.
Stickers are fun. Y'all don't like stickers?
And that hashtag protect your temple.
Protect your temple.
Love that. Okay, thank you for joining us. This has been the first episode of Pride in Our Health. And in combination with Let's Talk Getting to Zero.
Anything going on in the community that you would like for us to highlight? Like Tanika said, any heroes in the community, any unsung heroes in the community that you would like for us to, have a little conversation about, and to
Or
provide
sheros.
Sheros.
Queeros.
Period. We want to provide this platform for them to, share their knowledge, their wisdom, and to share that with all of you. So, yeah.
Awesome. Thank you.
Thank you all, and join us next time for episode 2 of the Pride in Our Health podcast. See y'all later.
Woo,
Whoop, whoop.
bye.